everyone, Kirsten Wagner here with Bellevue Physical Therapy. I'm a therapist at the Papillion location, and today I'm going to walk you through some of our simple knee exercises following a knee surgery. Okay, so if you're a post-op patient, maybe you had a total knee replacement, maybe you had an ACL reconstruction with or without a meniscus repair, maybe you just had a meniscus repair, maybe you had a knee scope where they did some debridement. Whatever the surgery may be, these are typically our go-to starting off exercises where we're working on quad control. So this front muscle here at your thigh, working on getting that activating and going. Quad control, we're going to work on range of motion here, a little bit of bending and straightening, flexion and extension, bending and straightening, and just overall strength of the hip as well. So I'll go through some of these for you. I do want to say this, that depending on the surgery, you may have specific restrictions or things that you should not do yet. So above all, I want you to listen to your physical therapist's advice and what they're asking you to do. If you haven't done this in a session, if they didn't tell you to do this at home, don't do that exercise. Feel free to bring it up to your therapist if you feel it might be helpful for you, and they'll let you know whether it's okay to do or not. But like I said, maybe especially like those meniscus repair surgeries, you may be limited in what you're supposed to do or what ranges of motion you're supposed to go into. So listen to your therapist, follow the surgeon protocol. If you have questions, just ask your physical therapist, okay? So let's get started. With our exercises, you might want kind of a rolled up towel here, a little bolster, as well as a belt or something that you'll be able to reach when it's around your foot. So sometimes I have people use a sheet or something too, but you can get those tools ready to use. We're gonna start off with the exercises that are getting this quad activating and firing. So you can start, we'll pretend it's my left knee here. You can start sitting up here, towel propped under the knee. You can do this either seated or laying back, but put that under the knee, and we're gonna think about contracting this quad. So I'm gonna do a quad squeeze. You can see my heel comes off the ground a little bit just because of my towel's a little bigger. It's giving me a little bit of bend in the knee, so as I squeeze, it's straightening out my leg. You can see I'm activating that quad here. We want to avoid squeezing the butt muscle a whole bunch. We really are trying to selectively get the quad here. So you could try it seated, try it laying down. If you're having troubles getting that to go, sometimes I'll have patients do both legs at once, so I'll straighten them both out, kind of getting the brain to help out, like, oh yeah, that's what it's supposed to do on this other side as well. So you can mess around with that a little bit. That's exercise 1, quad sets. From there, we're gonna go into a straight leg raise here. So you're gonna lay back, same thing. I took that out from under the knee, but you're gonna do a quad set. So I'm tightening that quad, turning that muscle on, and then I'm gonna do a lift. Nice and controlled, okay? So, depends on how many sets and reps your therapist prescribed for you, but you're gonna lift to about the level of your other leg, and then lower. So that's also for the quad and for the hip flexor a bit. We're gonna move on to a hip muscle here, more on the outside. Just for ease of the video, we'll switch it and pretend it's my right knee here. But I'm gonna lay on your opposite side so that your surgery leg is on top. And I like to, I've got all my tools here. I like to bend that bottom leg so that I have some stability and support. Don't feel like I'm wobbling or gonna fall over forward or backward, okay? I'm gonna get my hips stacked, perpendicular to the floor. A lot of times I see patients rolled back like this, not quite all the way up on that hip. So get up on that hip, keep the legs straight, in line with the body, or even a little bit behind you, not a ton, just hinging at the hip here. But what I want to avoid is having that hip way out, or that leg rather, way out in front of the hip, okay? So either in line with your body or slightly pulled back here. We're gonna do side lying hip abduction, okay? So those are coming that way. This is gonna work more of those hip muscles, keeping that hip nice and strong, okay? Next exercise we have here is to start working on some of our range of motion. So this is where the belt comes in, or a sheet, something like that. I like to use a belt. Get it around the toe. This usually helps if you take your shoe off as well, depending on what surface you're on, but it's gonna give me a little bit of friction probably. But I'm gonna use this belt to help me bend the knee. Okay, it's called an active assisted range of motion exercise. So you're trying to bend the knee, you're using the belt to kind of help you with that, keeping it in a comfortable range. Maybe your therapist is telling you, hey, I want you to push that one a little farther. Maybe they want you to keep it in a comfortable range. But all in all, use a belt. You could use, like I said, a sheet. A sheet might be a little longer, so then you could do it more in this laying down position if that's more comfortable for you, that's okay. But that's just to give us a little extra help with bending the knee. Okay? And then we are also going to work on a calf stretch. Same position here. Maybe you bend this other foot a little bit. I'm gonna get that belt up on the toes. I'm gonna let the knee stay straight, and I'm just gonna think about pulling back on those toes. So I'm getting a nice stretch here throughout the calf. But it's a calf stretch we can do without having to stand on it. We can just do it in this nice, comfortable position. It's important to keep that calf stretched out and loose so that it doesn't limit us into our extension as well. So pulling back on that calf. Usually I tell patients, 25 to 30 seconds, and it's helpful if you can use a clock or a watch, timer, something, because if you're counting in your head, most people are gonna count faster than 30 seconds actually goes, but you wanna get a good stretch in there. You don't have to crank on it, but make sure you're feeling some sort of a stretch as you hold that. Okay, let's see here. And then the last one here is to work on that extension, like I was just mentioning. So, getting our bolster back out here, putting it underneath the heel. So you can see this props my leg up, gives me a little bit of space under the knee. And for me, I might have a little bit extra extension. So get something that gives you some space here where you can actually feel a stretch behind that knee. And you're just gonna try and relax. I think it's easier to relax if you lay back. It's up to you, but the whole goal here is to keep the toes up straight. You don't wanna let the leg rotate out because then you are not working on the straightening. Keeping the toes up, letting that knee just straighten out and stretch. If you're limited in this range of motion, if you're lacking some of that extension, this might be a little bit uncomfortable for you. But extension is very, very important, and one of the first things we are aiming to get back after surgery, because extension is a very functional action for us. When you're walking, you need to be able to get your knee into full extension so that you're not limping around and causing compensations and making other things hurt in your body. So that's a quick recap. That was 6 different exercises, so that was a lot there. But once again, I want to point out, if your physical therapist did not give you one of these exercises, just do the ones that they gave you to do at home, okay? You can ask about the other ones in session, but stick with the ones they gave you, listen to their advice, follow the precautions, but give these a try. Hopefully this helps, little tips and tricks and things to remember. So let us know if you have any questions.